So as Greg has already said, so our focus this evening is maternal care. And this evening we get to hear first from Florence, who's joining us all the way from Uganda. Apparently it's 20 to 10 there, so I've already told Florence that that's past my bedtime. So yeah, so thank you so much, Florence, for joining us this evening. So Florence heads up the Special Children's Trust, who you might have heard us talk about in previous campaigns and things we've run before. They support disabled children in Uganda. Part of the Special Children's Trust is Berakhah Medical Centre, who provide medical care to the local community. And they are looking to expand the medical centre to add a maternity wing to be able to support more mothers. So Florence, over to you, and thank you again.
Thank you, Hannah. Good evening, everyone. Can you all hear me?
Yes.
Maybe I'll briefly put on my video so that you can. Okay. Well, that doesn't seem to work, but yeah, my name is Florence Namaganda. I am the founder and director of the Special Children's Trust. The Special Children's Trust is based in Uganda. And yes, thank you so much for being here tonight. And I would also like to thank you so much, the team at MMN, for inviting me to be with you tonight. Thank you very much. I'd like to share my screen now. Can you see it now?
Yes, we can.
Okay. Okay, so yes, I'm from the Special Children's Trust. And as I said, the Special Children's Trust is based in Uganda. And we founded that in 2006. So we're about to make 18 years. And the whole purpose of the organization was really to meet the needs of children with disabilities and their families. I will just share a few facts about the Special Children's Trust, or Uganda, first of all. Those of you who don't know, Uganda is in East Africa, and we have 42 million people. 65% of those are children below the age of 18. And as WHO says, most people with disabilities are in low resource income countries like Uganda. And so therefore in Uganda, we have about, 19 to 24% of the Ugandan population has some form of disability, but 3.5 of those are children. 3.5 million of those are children, and even more because these statistics are from 2014. We haven't had a census since 2014. So, so we're sure there are many more children with disabilities, but only 5 to 15% of those have any sort of help or have any intervention. And most of the disabilities that we have in Uganda are due to preventable causes. And one of them is poor maternal health. So, and then children who are born with disabilities in our country usually do not live up to their 10th birthday, majorly because of poor medical services. And also there's a lot of myths and beliefs surrounding disabilities that cause parents to neglect, to hide, and not take care of their children. So as the Special Children's Trust, we came up, as I said, 18 years ago, to make sure that people know that their children are not a curse, their children are not punishment for sin, their children were created by a loving God who cares about them and has a plan for them. And so when we started out with a small drop-in center, and have now grown to serve over 7,000 children and have 4 locations. I will just, that is our vision and that is our mission. Yeah, I'll just let you read that. And basically, the basis of what we do is rooted in this verse, that we are all fearfully and wonderfully made, and we are made for a purpose, and that God makes no mistakes, because he knew us even before we were formed in our parents' womb, in our mother's womb. So he knew how we'll turn out, and so children with disabilities as well. And this is the message that we tell our parents, and this is a message that we try to spread through our work. And our work consists of 5 key areas. One of them is education, another one is health, another one is family empowerment, where we take care of the entire family. And we also do, so when I say take care of the entire family, what we do is make sure that the siblings, the parents, the guardians, the neighbors, everybody involved in the family knows that this child is precious and is also designed for purpose. And so whatever that looks like for an individual family, that's what we do. We do a lot of advocacy and awareness work across the country, and we start from family level all the way to government. And then we do capacity building for service providers and everybody else in the disability space. And so our goal is to make sure that we rally around this child, provide them with everything they need to live to their full potential. And those currently we have 4 locations, and those are our 4 locations. So one is Mukisa Foundation, another one is, so Mukisa Foundation is a drop-in center for families where they can access anything that they need, anything that the child needs. And then Dawn Children's Center is an inclusive school. And the Mukisa Inclusive Village is a vocational training center as well, which has different vocational skills, including farming, and it's on an island. But all these centers will have health programs as well, including therapies, medical care, among others, and also access to assistive devices. But yeah, today we're talking majorly about this one, which is Berakhah Medical Centre. So Berakhah was formed 2 years ago in 2021, and the whole reason for creating Berakhah was to, one of the major reasons was to prevent disability due to preventable causes, and we have found that most of the disabilities are due to poor maternal health, and so almost half of the Ugandan population will not attend antenatal care, and then they will not also deliver from a health facility. These statistics are changing, and if you research, you'll see very many different ones, but the real fact on the ground is that most mothers will not go to a hospital to deliver their children, and therefore, because children are not born in safe spaces, the children usually end up having a disability. So the largest, how can I phrase this? The biggest disability in Uganda, or condition that causes disability in Uganda, is cerebral palsy, which stems from delayed labor, and most of the children that have cerebral palsy in Uganda, you'll hear the same conversation with the parents saying the child did not cry at birth, child was delayed, we did not get to hospital in time, or we waited until they found out that we couldn't deliver the baby, but it was too far out to go to a hospital. So there are things like that. Or the children are delivered by unsafe methods like vacuum deliveries, vacuum extractions, or using tongs, or using other sorts of things. Then many mothers are also malnourished, and nobody knows because they haven't attended antenatal care. Nobody is taking their weight. Yeah, so many of the disabilities are caused due to preventable causes, and that's the reason why we decided to create a medical center. But also the other reason why we have a medical center is to make sure that we have early intervention, that when children are born, they are screened for any form of disability and then treated immediately. And then we also found that many mothers usually bleed out or get infections after they've delivered because there is not adequate postnatal care. And then the other reason why Berakhah exists is to provide assistive devices like wheelchairs early on in a child's life so that we can prevent secondary disabilities and help children live to their full potential. So Berakhah Medical Centre has all forms of, sorry, I'm looking for the right word. So we provide general medical care, and then we provide antenatal care, and then we provide diagnostics, that is, so we have a laboratory and all other forms of diagnostics, and then we also have a maternity. So our maternity right now consists of just one room with a delivery bed, with a warmer, and also a receiver. And we currently deliver up to about 20 babies a month. That is our capacity right now. But the biggest challenge is, while of the 20 mothers, at least, so right now we're delivering about 5 to 7 babies a week, but of these 7, at least 3 would need surgery or would need a cesarean section. We are about maybe 10 kilometers from the main tarmac road. So that means if a woman cannot deliver a baby naturally, then would have to find a way of taking them to the nearest medical center. But to get to the nearest medical center, which is about 20 kilometers away, you go through, I wouldn't even call it a road. It's like, Greg is smiling, so I'm not sure if he knows what I'm talking. I think you probably have seen our roads. Our roads are very, yes. I can't explain them any better than saying it's not what you could imagine as a road. So there's a lot of potholes, and not just British potholes, but Ugandan potholes are like a big leg sometimes. So you have to take this mother from our medical center to the nearest safe place where they can deliver their baby, or where they can have a C-section. And so the transport system is terrible, and also usually we use motorbikes to transport them there. And so as we are trying to prevent disabilities, sometimes I feel like we are also creating a situation where a mother is unsafe and also a child may not be safe. So yeah, so the biggest challenge right now is having our own theater where we can do safe cesarean sections. And also, let me just show you. Yeah, so we'd like to be a specialized center where we can provide safe C-sections and other surgeries that are required. So some minor surgeries for pregnant women, but also for children when they're born. So we'd like to be able to do that ourselves. And then we would also like to have diagnostic equipment to help with tests and examinations, especially when children are born with any form of malformations or any form of disability, so that we can encourage early intervention. And if we are doing deliveries, or if we're doing C-sections, then the parents have to stay a bit longer. I mean, the mothers have to stay longer with us. So we'll need an inpatient wing. What I forgot to say is our center is really outpatient. Only when a mother delivers do they get to stay with us, or when a child is seriously, when a child is critically ill, they can stay with us for a couple of days, but we don't have the capacity to keep them longer. But if we are doing C-sections, we'll need to have an inpatient wing and an ambulance to take our parents safely to bigger hospitals if needed, or pick them from their homes safely to bring them to our center. Yes. And now I would take any questions if anyone has any.
How many of those facilities do you have, and how many of those facilities are you still waiting to have?
Which facilities, sir?
The theatre and the assistive device workshop and the diagnostic equipment. Have you got all those, or are you still waiting to get those?
So what we have right now, so this here is the building, the Berakhah Medical Centre building. Should I put more photos of this? But yeah, so the upper section is the medical wing, and the lower section is the mobility hub where we fabricate appliances. So this is what it looks like right now. But what we are hoping to do is remove the mobility hub, move the mobility hub out of the lower section and make it the theater as well as the inpatient wing, and put the mobility hub somewhere else on this property. We have about 9 acres of land, and on this we can move the mobility hub to another place and then have the theater and the maternity below. So to answer your question, we have the building. It just needs to be modified in order for it to be more suitable for maternity as well as inpatient care.
So you have the CT scanner and the EEG machine?
Oh, no, we don't have those. We don't have those as yet.
Right.
So that is our dream, that we can have those as well.
Point for prayer. Thank you.
Yes.
You mentioned that there's a lot of myth and superstition with regards to people attending maternity services. How is it that you counter that to the population of Uganda?
I beg your pardon, sir?
So that there's a lot of superstition and myth in Uganda.
Yes.
How is it that you tell the people that they are fearfully and wonderfully made? So, how can you minister to these people?
Yes, so we use every opportunity to talk about, one, our faith, but also the truth, speak the truth about, so as to demystify disability. So we come with the medical knowledge. We tell parents, so for example, if a parent thinks that they were bewitched, but they have a child with cerebral palsy, we'll do an assessment and tell them that actually you were not bewitched, your child has cerebral palsy, and this is the reason why they have it. Mm-hmm. And then also share our faith with them and tell them that regardless of what your child looks like or turned out to be, or whatever abilities they have, they're created by a loving God who has a plan for them. Yeah, so we use both of scientific medical knowledge as well as our faith to demystify disability, because the tendency for us in Uganda is to make up reasons if we don't have a reason. And for most people, it feels like there should be something must have happened for them to have a child with a disability, because when people get pregnant, they're not thinking that they'll have a child with a disability, but when they come out with a child with a disability, then they come up with beliefs and myths that are cultural to kind of come up with a reason why that could have happened. And usually these are harmful myths that cause neglect as well as abuse, because then there's a lot of shame and blame to the parent, and then the parent decides to hide their child because they don't want anybody to know about them, and then they're not seeking help, and eventually these children die before their 10th birthday for most of them, as I said.
Thank you.
Thank you so much for sharing that, Florence. It's an incredible amount for us to be praying for, but it's amazing to see how the project's grown over the years and the impact that it's having and the amount of children that it's supporting. But yeah, I mean, you may have seen that through MMN, we are hoping to raise support for the Berakhah Medical Centre over the next couple of months to enable them to provide this support to mothers. And obviously, as Florence has said, the prevention that can happen of babies being born with disability and the positive care that mothers can have through the centre is groundbreaking. So thank you so much, Florence, for what you've shared this evening. And we look forward to hearing more as well over the next couple of months about the centre and how things will change there as well, hopefully. If you are able to stay and join us for prayer later, then we would love you to join us. But equally, if you do need to leave the call for time purposes, then we completely understand. But thank you so much again for this evening.
Thank you for having me.
Thank you.